Doctors aren't mask experts. They bring in what? An OSHA professional. Occupational Safety Health Administration. Government agency that focuses on air quality and what you need to do when wearing a mask, how to wear a mask. I'm honored to be joined right now by Tami and Kристен. You guys, what made you, well, let me take it back a step. What does it mean to be an OSHA expert?
Well, for me, I spent 9 years on active duty working in bioenvironmental engineering. What we do is we act as liaisons with government agencies and workplaces to make sure that they are upholding OSHA law and environmental law, because everyone has the right to a safe and healthful work environment. So we are credentialed in all the OSHA laws and the hazard risk analysis involved, and we just make sure that companies are compliant.
Now, when I think of masks, who knows more about masks? The doctors wearing them, or you actually go in and train doctors how to wear them and fit them? So is it, where do you think that line is when people say, well, my doctor says, and they know more than Tami Klart? What would you say to that?
Right, yeah, so this has been one of our biggest issues because doctors specialize in medicine. OSHA professionals, PPE experts like Kристen and myself, specialize in PPE and respirators. So our world basically revolves around taking a workplace and with doctors or nurses or surgeons, that happens to be the medical systems or the surgical environment. And so we go in and we assess the risks and the hazard in that work environment, and we determine what type of PPE or respirators they need to be wearing and why. And then we train them on how to properly don and doff their PPE, how to properly wear it. We have to do a medical evaluation to make sure they are fit enough to work in that PPE. Then we have to do fit tests and things like that. We don't explain all of this to the doctors and nurses. They don't need to know all the technicalities behind what we're doing. All they know is, I can work in a surgical mask all day and it's not really that big of a deal. They don't even understand the ASHRAE standards and the increased ventilation and air cycle exchanges that go into the mechanical designs and the HVAC designs of that hospital environment. They have no idea for the most part, unless they're like an OCDOC, an occupational safety and health doctor, who is trained to also do some of this. But there's very few of those professionals compared to the overall, healthcare worker environment.
You actually have a private company, your own company, right? That actually deals with PPE,
yes.
And this is what you do.
That's what I do. Yep, I have been a consultant for many, many years as an OSHA credentialed professional and a court-approved subject matter expert. I was in the university setting teaching for a while, but I was just getting so many requests to do things on the side, and of course I had kids, so I couldn't do it all for very long. So I started my own company about 10 years ago, and all I've been doing for the past 10 years is compliance, training, testing, working with all kinds of industries, from hospital settings to construction environments, basically helping to make sure that health, safety, and compliance programs are in place so that no matter what type of pathogen or exposure we're talking about with that particular company, their employees are safe.
So we're now seeing a world of masks, a future of potentially wearing masks forever. As professionals, when this all started, when you started seeing them, first it was locking down, right? It was social distancing, and then this mask thing seemed to come out of nowhere. And we saw virtually every professional, from Fauci himself to the Surgeon General, saying, oh yeah, you don't want to wear a mask. In fact, it might even spread the illness. At the very least, it's going to do nothing at all. Why did you decide to, what was it in your world? I don't live in a mask world. This is what you do for a living. When you started seeing on the news, we want everybody in the country wearing masks, what was your first thought?
Well, that was the red flag for me. That's why I jumped in and got involved. It was all very concerning to me because it didn't make sense. But originally, when the experts, including Dr. Fauci, was saying, healthy people do not need to wear masks, there's no need for that. And then all of a sudden, we started getting this COVID fatigue, and we were kind of getting over it at about week 3, 4, 5, right? Yep. All of a sudden now, everybody flip-flops, and we need to mask up. And I went, whoa, 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 we don't just mask up. That is not only illegal and it violates our civil liberties, right? It is incredibly dangerous and unsafe and unhealthy. And that's when I started speaking up, and that's how Kристen and I met.
Well, also, within my career field, I used to work in hospitals, and I've sat on numerous infectious disease boards. And what I did is I sat and educated nurses, doctors, surgeons on how to deal with flu outbreaks, the SARS outbreak. So I knew, yes, there's something called the hierarchy of safety and controls. We have the engineering standards, there's work practices that you change. PPE is a last resort. But when you're dealing with infectious disease patients, these are not the masks that you wear. Even N95s are not fully rated to protect against a virus. These micron sizes, again, they're not rated by the National Institute of Occupational Safety and Health. They're not approved for this use, so not only is this a bad idea, there's numerous studies for years based off of the flu outbreaks across the world several years ago that not only do these ear loop masks and cloth masks not work, they're increasing the spread through fomite transmission, which is a form of cross-contamination. You're touching your face. No one is trained on when you're supposed to change these out. No one is trained that when they're soiled or you're working in a humid environment. These things increase the spread. You re-inhale your exhausted gaseous waste, and you can increase your viral load. So if you are ill, not only can you continue to spread it, because you're not understanding the hand hygiene aspect of that, but you will be sicker longer. The studies have been around since the 1970s that, yes, masks can decrease oxygen by 20%. This is exactly why prolonged mask use is not approved in the workplace. If you were to wear a mask 8 to 10 hours a day, like some workers, that goes against OSHA law, and you have to implement work rest cycles. They're not allowed to be in masks this long because we already have the data that shows prolonged mask use is unhealthy.
So we have, I think now, here in Texas, last week we were talking to a bunch of parents. We're all sending our kids to school wearing masks. Everybody's wearing a different kind of mask. Some kids have N95. I've even seen kids with 2 masks. They've got the N95, then the blue one over it, and then the plastic face shield. And they're going in for hours at a time. And I remember one of you, I think, in the video said that when any company is going to start masking for whatever reason, that you go in and test the health of the person and you see if they can handle a mask, correct?
Yes, that's what OSHA's respirator standards are based on. We know we have all the studies, like Kristen said, that shows oxygen levels are reduced by up to 20% by putting on a mask, by covering the mouth and nose for a prolonged period and breathe. So we have the studies. This is why OSHA created a respirator standard in the first place, because the NIOSH studies are there. NIOSH is the National Institute of Occupational Safety and Health. They're basically OSHA's sister agency that does testing. Okay, so we've had these tests for years and years. So now to just tell everybody to mask up and it's not a danger is not only unethical, but it's illegal. So it's not legal in the workplace to allow an employee to work in a mask or face covering without first doing a medical evaluation to make sure that that employee can medically tolerate it, because we know it's very taxing to the cardiopulmonary system when you cover somebody's mouth and nose and then you force them to do their work. Even if they're not working and they're just sitting, it's going to tax their cardiopulmonary system because it changes the way you breathe. You have to forcibly inhale, forcibly exhale, and so it taxes the cardiopulmonary system. We've given people heart attacks by forcing them to do this, and that's why OSHA created the respirator standard in the first place. So the danger and the biggest issue here is OSHA's running around saying, well, this isn't PPE, so it's okay. That is not true. That is not true. When you force somebody to wear anything for protection against a known pathogen
what
or
difference
airborne
does it
hazard,
make what the title of why you're wearing it?
PPE.
If this thing can cause a pulmonary issue,
Exactly.
whether or not it's PPE or it's just wearing it for Halloween, at a certain point you say, if you're wearing this for hours, it's dangerous. We've got to see if you're healthy enough to do that. We're making an assumption of every child, but when I think about it, how many elderly, that do have heart conditions and issues are wearing this now, wearing these masks, thinking this is protecting them? What type of risk are they being put at? And why aren't our nursing homes and hospitals and retirement communities bringing in OSHA to say, can you test and make sure this person is capable of wearing this?
Yeah, well, the problem is OSHA is denying that this is a problem. I actually had a phone conversation with the director of the enforcement division in Michigan, and I said to him, your guys are running around giving citations to my clients in the field for not wearing masks or threatening them for not wearing masks. When I told them when this all started, look, you're working in the construction environment. It's hot. It was the middle of the summer. You're doing roofing work. You're doing whatever. You are not to be working in a mask. I would be remiss as a safety consultant and your acting safety director if I let you do that, because I know that that's going to reduce your oxygen levels. The last thing I need is for you to be getting dizzy on a ladder or on a roof, right? So you will not follow these guidelines and mask up. That's not only unhealthy, but it's unsafe. So I called OSHA about this, had a conversation with the director in Michigan who told me, I said to him, what are you doing? What is going on here? This is revisionism. You are not following your own standards. You know that it's very unsafe and unhealthy and we're causing oxygen deprivation. Why do you think everybody's complaining of headaches? Nausea, fatigue. That's the first signs and symptoms that the body is struggling to meet demands for oxygen. And he said to me point blank, I wish I had recorded the conversation now. He said to me, Tammy, you will never get me to believe that. And I just said to him, I don't care what you believe. You're an industrial hygienist. You know what I'm saying is the truth.
Wow.
Yeah.
So you, Kristen, you were in the military.
Yes.
And you worked in the OSHA. I mean, you understood OSHA.
I was actually an Air Force DoD liaison for OSHA. I was the highest level person in my profession with ties to OSHA. Not rank-wise, but my duty-wise.
Wow.
Yeah,
So,
I went to every OSHA conference program. I mean, they wanted to hire me when I got out of the Air Force. I said no.
so both and thank you for your service. You protected this country. You also made sure that our military were safe when it came to wearing, wearing masks, things like that. But now you see this country that you defended, that you fought for. We're watching politicians make decisions with they don't know what they're talking about. Clearly.
No.
All right, how about this? You have Robert Redfield, head of the CDC, saying this is the most important thing you can do right here, more important than a vaccine. What does this make you think about this country?
We've had OSHA's respiratory protection program in place as law since 1979. So this is not new for people like us. And when you have people who are not credentialed in this law or the science behind the masks, and it's not just about degrees, it's not just about the law. We've been in the field. I've seen nurses faint. I've seen surgeons have to walk out of rooms because it was too much. And those are controlled environments. So all I thought was, we are completely removing decades worth of data for a political agenda. That's the only thing I can tie it to. And I just wish that more professionals came forward, because not only is this not going to decrease the spread of infectious disease, this will increase the number. So
then here's the obvious question, the elephant in the room. Where is OSHA? I mean, the entire purpose of OSHA, this is right in their wheelhouse. This is the watchdog for our country to make sure that anyone wearing a mask is safe. And I haven't seen anyone on CNN, anyone on MSNBC. Where is OSHA saying, hey, if this is what we did with Ever. This is what you're saying is too high a CO2 level. This mask is off the charts for my kids. So someone wanted to explain to me from OSHA how this is safe. Where are they?
Well, we would like to know the same thing. We have been saying the same thing. We have been screaming it loudly. In fact, we've talked about it. We'll probably lose all of our OSHA credentials. I'm being audited right now by OSHA because I'm being very vocal, and I'm speaking out because this is just simply wrong. This agency was created to protect workers in the workplace. Now they are enforcing on employers that employers are to be the mask police and force their employees to do something that we know by the data and the tests that we have is not only unsafe, but it's very unhealthy. It will create long-term health effects. That oxygen deprivation over long periods, not only is it immediately, you have that acute immediate issue with headaches and fatigue and nausea and things like that, but you're creating long-term health effects too. When you deprive the body of oxygen for a long period of time, it reduces immune function, it causes cancer to be able to grow and thrive, a more acidic environment, because you're increasing also the CO2, which causes hypercapnia and all of that. So where is OSHA? Why are they turning completely now and saying, oh, well, we know that this is a hazardous environment, and so they're lumping it under that. You know, we have an infectious disease, this is a hazardous environment, so in order to protect everybody, we have to do this. But they're creating a cure that's worse than the disease itself. And they know. Those within OSHA at the higher upper levels.
So now tell me about, you sort of breaking a story here. You came in this morning, you said, hey, we have proof. We've got one of the heads of OSHA down in Florida.
Yeah.
Tell me about this.
Yeah, okay. So we yesterday, 2 days ago, stumbled onto some information by one of the directors of OSHA in Florida named Aaron Sanchez. He wrote a thesis when he was working on his master's degree all about the efficiency and efficacy, basically, of masks. Wow. And this is really interesting because what we found, and I'm going to read a couple little blurbs for you because this is right out of his writings.
Okay.
Now he's a director of OSHA, and where are we going? Crickets,
hiding,
right?
Shivering in his basement somewhere.
He knows this is not right.
All right.
And yet, if he stand up and says something, he'll lose his job, basically, right? Okay, so he says, surgical masks are not designed to protect healthcare workers from airborne particulates and will not provide as much protection as N95 respirators. So he was studying a surgical mask or a face mask versus an N95, which is an entry-level respirator.
Right.
Okay?
Both sealed and unsealed.
Right.
Okay.
Because we know, and Kristen will get into some of the studies in just a minute, this was based on the 2015 studies that, well, and going back to 2008, that there has been infectious disease outbreaks in hospitals among healthcare workers, but yet they're all wearing surgical masks and N95 masks. How is this happening, right? So he studied then the efficacy and the efficiency of the different types of masks. And what he finds here, and it says right in his, I'm reading right out of his report, surgical masks have been recommended by the CDC as a last resort. Remember, Kristen referred to the hierarchy of safety and controls. In our world, that's everything. You don't start with PPE. You try to get the hazard out. You try to engineer it out using administrative controls or whatever. And if you can't reduce or eliminate the hazard, then we put people in PPE.
Right.
What OSHA has done is they have started out by putting everybody in PPE. So right there, they're not even following their own hierarchy of safety and controls.
Okay.
Let me keep going. When no National Institute of Occupational Safety and Health, that NIOSH that I was saying, approved respirator is available. So we're supposed to be using them last. Now, using surgical masks as a form of PPE may lead to adverse health effects. Boom, mic drop, right there. Enough said.
Right.
We have a director of OSHA saying using surgical masks as a form of personal protective equipment may lead to adverse health effects. We know this.
Wow.
So what are we doing?
I mean, especially when you look at the numbers now, we're dealing with a virus that they're now saying 99.98% of us. So 0.02% of us are at risk. And yet this is clearly a higher risk than that if you're discussing it, you know, with doctors wearing it.
Absolutely. So let me go on real quickly. I just want to read one more thing. He says here, surgical masks are not tested under the NIOSH certification. Here's the important thing about that. When you're putting somebody in personal protective equipment in the workplace, that respirator, that face covering must be tested, must be NIOSH approved. He says right here, surgical masks are not tested. Face mask, cloth face mask. Yeah, they're telling you, just make your own homemade cloth face mask.
Yeah, just sew it on your sewing
machine.
Whatever. It'll be great. It'll work great.
There's no testing.
Wear it 6 days straight, hang it on your mirror, stick it in your ashtray, throw it back on, touch it.
So then lastly, he says under 29 CFR 1910.134, that's the OSHA respirator standard, the Occupational Safety and Health Administration, OSHA, requires use of NIOSH-approved respirators for protection against airborne diseases.
There you go.
It's all right here.
And what is being cited in this thesis statement, when I tell you that there's studies that exist, it all started to be, the first clinical studies were done during the SARS outbreak.
Yeah.
And it is here in black and white in numerous studies. And these were a multidisciplinary study. It was not just one group of experts, it was a whole crew. And it's hilarious because it's not funny, but it is funny because it's right here. It talks about how this data from this study, that not only were these hazards to human health, they worked almost 0% of the time because of moisture, liquid diffusion, and pathogen retention. And it even said that trying to do double mask, like you mentioned you saw, it causes the most adverse health effects with decreased oxygen because it already says one mask decreases oxygen. And this data is just, it's monumental because you've got governors and schools and public health departments trying to shame people. It's not about not wanting to wear a mask. If these masks worked, we would be the first people promoting them.
Right.
They are doing more harm than good. And the saddest part of it is when you go to these stores and you see little cartoon character masks, and these companies have no studies on the breathability of these masks. And I just want to close it with this part about this study. When we talk about the OSHA requirements, training is a huge aspect of it. So now you've got people saying it's a one-size-fits.
What we need to understand is we need to lower the fear and we need to look at the data because this virus is really not that scary.
Right.
And people are terrified. So if we get the facts out there and we remember we cannot remove all risk from our lives, right? And that's what people are afraid of. They're so afraid of dying that we've stopped living. So look at the data, lower the fear. Don't be afraid to stand up and speak up because the power of one can really lead to the power of many, and that's exactly what happened in Michigan.
Tami, Megan, you guys are real heroes. And I'll be honest, of all the people I've had on here, what you're saying is, to me, you're coming from a place of knowledge that nobody else is. I can talk to doctors. I've heard them sort of meander around this and show studies, but you work for OSHA. You know what this is all about. It's really great to have your voices out there. I think really you should, you know, I would consider you're whistleblowers. I mean, you are people that work for OSHA. They are not speaking out. You are. Thank you for doing, you know, your service to this country.